just a quick little chronic illness update, because I haven't done one in a while. No major developments. Today I went to a hand specialist, because, as I think you know, my hands have been bothering me a lot. I guess bothering me is sort of an understatement. I haven't slept more than 2 hours each night for 3 or 4 weeks now, because the cutesy term is painsomnia, but basically the pain keeps me awake, and I haven't found anything that helps at all. I am going under the assumption that it is from carpal tunnel pain. I have had carpal tunnel, well, I was diagnosed with carpal tunnel when I was 14, but it did not bother me very much at all. I would just get occasional like weakness or numbness, and it didn't really affect me too much. And then starting like last summer, when all of my other weird symptoms started to arise, that was one of them. I was getting a lot of numbness in my hands and a lot of pain in my wrists and my hands, and swelling in my hands, especially in the morning and overnight. So when I got some nerve testing done at the neurologist, they were testing for something else, and so they just looked at my results and were like, well, there's nothing else weird, just this carpal tunnel. But we already knew I had it, so it wasn't addressed, and that was that. And then it's gotten worse and worse and worse. And I've tried everything that you're supposed to do for carpal tunnel. I wear a brace all day at work. I wear a brace, both braces, while I sleep. Does not help at all. I've tried doing little stretching exercises that they recommend, did not help. I was on a high dose of prednisone for 6 months. It did not help. So there's a chance, I think there's a chance that it's, it is carpal tunnel specifically, but I think it's really coming from somewhere else. I think that maybe there's a compressed nerve higher up in my cervical spine. Sorry, the dogs are tapping around. But I don't know yet. And the thing is, like, I'm a very good patient for the doctors. I am 100% compliant, meaning whatever they prescribe me to do, I will do it, and I will do it perfectly because I want to get better, and I'm just a very good rule follower. So I'm a very good patient in that regard, but I'm not a very good patient in terms of advocating for myself. I get very nervous, like I'm wasting their time or something. So every time I go into a doctor's appointment, like I did this morning, I go in with like this list of notes on my phone, and I've written out everything I want to say, everything I want to ask. I want to give them my whole history. And like with this hand specialist, this is the first time I've ever seen her, and she doesn't know me, and she doesn't know my medical history. So I feel like just going in and saying, oh, I have carpal tunnel, can you help me relieve the symptoms? I'm going in saying, I have all these other problems that the carpal tunnel could be affected by, or could be a symptom of, or it could be something other than carpal tunnel because of these other things. And so I go in with all these great intentions of like telling her my whole history of everything. But I always get shut down. I just go in and they just ask me question, and I just answer them. And like today I did this, I did the same thing. I went in and she asked me one question, like, what's wrong? And I said, well, I think it's carpal tunnel. I know I have carpal tunnel. I've been diagnosed with it twice. But, you know, I have a whole list of notes here, and I took out my phone and I just sort of started like my life history. And this, she, you know, said, oh, well, you know, do you have, you know, this or that, or let me, you know, she would like push on my hands, and like just stopped me from going over my whole list of stuff. And I know that, you know, they probably do it, they don't have the time, they're used to just, you know, treating the problem and moving on, but it's such a complex problem, and I don't have the balls to just say, hold on, you know, listen to everything I have to say, and then we'll move on. I just put my list down and say, okay, here we go. So that's on me, and I always try to do better, but it's just not, it's just who I am, so it's kind of hard. And so that's how it went today. You know, I started reading her my list, and then she's like, oh, well, bring your chair over here. We're going to give you a cortisone shot. And I knew that cortisone shots were like the next step usually in treating the carpal tunnel, but with ehlers-danlos syndrome, the problem is you don't, but very simply, there's not enough collagen in your connective tissue, and that is what sort of makes your body break down the way it does when you have ehlers-danlos. And it also means that when you're injected with things like cortisone or like a local anesthetic, the collagen is also what would keep those things local. It would sort of keep whatever they're injecting in the spot that they inject it. But when you don't have enough of that, it just sort of metabolizes out into the surrounding areas and then loses the effect of where you wanted to have it. So, you know, I wanted to explain that to her, saying I'm not sure the cortisone will work. I'm happy to try it, but this is my concern. But I couldn't. I just wimp out every time. I'm like, okay, do what you want. So I did have 2 cortisone shots. These are my little Band-Aids. I got one in each wrist. It was fine. It's like a long needle, like this long, but it's small. It's a normal tiny needle size, and they just stick it down deep in there and inject a whole syringe of cortisone, which is a steroid. And since I feel like 6 months on prednisone did not help, which is also a very powerful steroid, I'm not super hopeful that it's going to help, but I will try anything. So she said, first she said don't go back to work today, which is why I'm making this video, because I am home and not at work. And she said that it will be worse for the next couple days before/if it gets better. So that's fun. I'm really looking forward to being worse than it's been when it's been terrible. So so right now my hands feel like electrified dead mackerel, like 2 dead fish on the ends of my arms. Like they are like throbbing with numbness. They feel very heavy, a little bit of pain, but not like it normally is. I think it's more numb than pain, so annoying, but we'll see. I'm still hopeful that anything that can help would be nice. So next step is we wait and see if this works. and I'll go back in 2 weeks. If it, I'm a little confused at this because she basically said, if the cortisone works, sometimes it's curative. Sometimes it will work and you will never have carpal tunnel issues again. I know that's not going to happen. But she said if it works, we've sort of proven that it's carpal tunnel and not something else. However, if it doesn't work, then they may go in and do the surgery. But I think what she meant was like, if it works, but only temporarily, then we know it's carpal tunnel, and then we could go in and do the surgery. I don't particularly want the surgery. It's not a major surgery. I'm not scared of it. I think really all they do is they like slice your wrist open and sort of snip a couple things to relieve the tension on those nerves. But my mother had the surgery done, and my aunt has had the surgery done, and neither of them got any significant relief from it. So I'm not sure that any risks really outweigh the benefits, or yeah, I'm not sure the benefits would outweigh the risks, but we'll see. I will cross that bridge when I get to it. So that's the update on my hands. My hands are definitely the thing that is bothering me the most right now. I still, feel ill. I've been on Plaquenil, which is the lupus medication, now for about 7 months. I definitely feel better overall than I did 7 months ago. So I do think that that's working as much as it can work. I feel good about that. I mean, it's good that something's working. It definitely means that I will have to be on it every day for the rest of my life, but I have had no side effects whatsoever, and it's totally fine. So that's good. I still am sort of overwhelmed with chronic fatigue, but it comes and goes. It is what it is. Then overall, just like pains everywhere. But the good and bad thing is that like there's always one thing that is bothering you more than everything else, and it sort of pushes everything else down. It's compounding in a way, but it's also like my hands have hurt so bad and have like stopped me from sleeping, which also messes you up, that all the focus is on my hands and how bad they are, that I don't really notice the other stuff that's still happening. So it's sort of a blessing and a curse because as soon as we get my hands under control, I'm sure that something else that has been happening will just bubble up to the surface and be my number one thing. But yeah, so anyway, I don't really have any other updates in terms of that. I think I already mentioned that I'm going to see the new rheumatologist next week. I don't really have much to present to him because I'm just meeting him so that he can become my new rheumatologist, since my old rheumatologist has closed up shop and will no longer be my doctor. So I'm not nervous to meet him, but I am hopeful that I like him, hopeful that he I just want to find a doctor that can see through me. I want a doctor that will see my long list of stuff and say, okay, tell me everything. And I want to be heard, and then I want to be considered. Heard and considered, that's all I want. I know that a doctor's a doctor. They can't care, like emotionally, wholeheartedly care about all their patients. I understand that. But I want to feel like they do. The only way I'm going to be comfortable with someone and telling them all of my bodily issues is if I feel like they actually care. So that's what I'm hoping for, is a doctor that at least can feign that, you know, he's really interested in making me feel better. So, all right, so I'm gonna say that's it because it's been 15 minutes already and none of this was interesting. But if you made it to the end, thank you very much. Thank you for caring. I'm just gonna keep, you know, living my life and trying to put out little fires as they erupt. So that's that. I hope you are feeling well, and I will talk to you again soon.